好，信報嘅想問翻兩條問題。咁你之前就話對成立疫情檢討委員會持開放嘅態度啦。咁有傳政府係打算去選內部人士去領導一個相關嘅檢討小組，但係面對一個咁廣泛嘅檢討範圍，你認為係咪應該要加入一啲獨立於政府嘅專家或者法官去入小組呢？另外，之前政府宣布暫緩全民檢測，其中嘅原因係因為香港係社區組織動員能力較弱，難做到全民篩查嘅效果。但係有聲音就認為呢個同早前有大批區議員離職或者被 DQ 有關，令到社區上面少咗好多社區組織聯繫性強嘅代議士。你點睇呢個說法呢？林太，唔該。
第一咧就其實昨天咧就勞工及福利局局長就係公布咗會喺勞福局牽頭有個工作小組嚇。今日就引起咗啲誤會咧，就係話就用一個勞福局嘅工作小組咧，就係等於咗一個咁大嘅公共衛生危機嘅全面嘅檢討咧。我喺呢度澄清咧，不是啊。嗰個工作小組嘅目的咧，就係目前我哋仍然覺得喺照顧安老院舍嘅長者嚇，避免佢哋感染，或者佢哋感染之後能夠第一時間係獲得隔離同埋治療，係有改善嘅空間。我哋亦都覺得今日有啲院舍佢哋喺院舍裏邊嘅裝備，特別係通風嘅系統有改善嘅空間嚇。咁所以咧就係透過成立一個由勞福局嘅常任秘書長牽頭嘅跨部門嘅工作小組咧，嚟到處理呢啲集中喺院舍或者係集中同長者感染相關嘅項目裏邊咧，從而係尋找改善。不但止改善今日嘅情況，例如更加多嘅感染院友可以更加早咁咧去進入呢啲我哋嘅暫託中心啦，就唔需要話一定要去咗急症室，再由急症室分流去呢個暫託中心啦。又例如啲長者如果感染咗喺一間急症醫院已經獲得治療，係咪真係需要轉2-3間康復嘅醫院先再去到暫託中心呢？呢啲全部都係可以改善嘅。所以我亦都係即係早前係要求勞福局咧，要更加專注去做呢啲改善嘅工作。但係呢個唔係替代咗早前我話有開放態度嘅檢討委員會嚇。我仍然係呢個立場。我覺得一個咁大嘅公共嘅衛生嘅危機，涉及咗相當多嘅死亡個案，而我喺呢度亦都對每一位離世嘅人士佢嘅家人咧係致以深切嘅慰問，所以係值得係一個全面嘅檢討啊！我早前都係提綱挈領講咗咧，檢討嘅範圍可以好闊嘅，包括我哋嘅醫療、福利、衛生呢幾個系統嗰個嘅互動同埋嗰個連接是否做得好啦？亦都包括我哋醫院管理局40幾間醫院而家呢種嘅比較係分聯網嚟到去提供治療，喺一個公共衛生嘅危機是否係最佳呢？今次就證明咧要定點醫院先係一個最佳嘅安排啦，就唔係將啲病人咧係分得好散。咁所以係一大堆嘅值得檢討嘅議題嚇。我曾經親自處理過不下數宗成立一個獨立調查委員會嘅工作嚇。咁所以如果你要我寫呢個獨立調查委員會嘅範圍咧，都係一個非常之廣泛，亦都希望一個非常之深入嘅調查。但係呢個而家我哋仲喺疫情嘅期間啦，而且都未能夠完全可以有信心咧，就話喺短期內會走出呢個疫情。咁所以作為現任嘅行政長官咧，我就真係唔覺得而家應該去分心處理一個咁大規模嘅調查嚇。相信下一屆政府咧係會認真處理嘅。如果下一屆政府需要本人作為呢一次抗疫嘅主體負責人提供意見咧，我好樂意提供意見。至於你話社區動員嘅能力呢個觀察咧，係內地專家講嘅，而我哋不得不承認。你今日睇下內地，無論係小區圍封 或者係好似上海市咁全民做呢個快速抗原測試嗰種嘅動員能力、派發能力、檢視能力，同埋上門去聯繫每一位喺區裏邊、喺大廈裏邊居民嘅能力，就顯而易見咧，香港係冇呢個能力。呢個能力我亦都唔相信係純粹係一個政治嘅體制裏邊嘅立法會議員或者區議員咧可以係提供到嘅。咁所以並不存在你剛才講嘅話，因為區議會嘅發生咗啲變化咧，就突然間令香港本來有社區動員組織能力，而家係冇咗呢個能力。
And for the death rate, now we have more than 7,100 deaths in Hong Kong. Who in the government do you think should help accountable for the state of affairs? And who should bear responsibility? And could these deaths have been avoidable? Thank you.
I cannot comprehend your last part. Can you repeat that?
So now we have more than 7,100 deaths in Hong Kong. Who in the government do you think should help accountable for this state of affairs? Who should bear responsibility? Could these deaths have been avoidable? Thank you.
Everyone in Hong Kong, including of course myself and my team, are very saddened by the number of deaths that we have seen in this fifth wave. And that's why we have tried every effort and every means to address the situation. Together with the very good advice we were given by the mainland experts, our strategy now is really to focus on the treatment side. And the first priority has been given to the elderly. And hence, yesterday, together with the Secretary for Labour and Welfare, we talked about how to take better care of the elderly. We set up a task group under the Labour and Welfare Bureau in order to ensure more effective communication and optimal utilization of the holding center and the various facilities that we have set up. And today, the Secretary for Civil Service is urging people to receive the vaccination so that we could protect our elderly better. Thank you.
So do you think the lowering of the ban to 7 days is good enough? And how will you make sure the changes do not increase the risk of transmission in the community?
Now, whether this will increase risk, there will be a certain degree of risk. So in public health control, most of the measures are a balancing of the risk and efforts to manage the risk in order to enable the city to continue, in order to address the social and development needs of Hong Kong and the individual circumstances of our people. We couldn't be too harsh with our people, and the people's tolerance has always been one of the factors that we need to consider in devising the best public health measure for Hong Kong. But if I could give you some figures, the risks, as I see it, will be manageable. One is, if you look at the whole of February, the rate of inbound passengers who were tested positive upon arrival was 0.76%. And for the month of March up to the 23rd, the rate was slightly higher, it was 1.1%. So if more passengers are coming back, so in absolute numbers there may be more, but we believe that these percentages, when compared to the Hong Kong current infection situation, should be manageable. And the second factor is because all these infected inbound passengers, the great majority were asymptomatic or with very mild symptoms. So although they were tested positive via PCR tests upon arrival, very few, or actually none, would need to be admitted into HA hospital. They could be transferred immediately to a CIF hotel, that is a community isolation facility hotel, for isolation until the test results turn negative, then they could be discharged. So the second worry about overburdening Hong Kong's public hospitals and hence affecting the hospital's capacity to treat acute or very critical patients, again, subsides. So the government's considerations is a very careful and balanced one. Whether we have communicated to airline, I suppose after announcement and even somewhat before announcement, the Transport and Housing Bureau should have talked to the airlines, but we will never be able to meet the aspirations and needs of the aviation industry in full because they are doing a business. Of course, they would not like any limitations or restrictions on how they should conduct a business. But we are in a public health emergency. So every business has to make sacrifices. The catering industry has been making a lot of sacrifices. Those CAP 599F scheduled premises have been making a lot of sacrifices because of the government's mandatory closure of their premises. So I hope and I make an appeal that airlines will also understand that we are striking a needed balance to allow some inbound flights to take place, but at the same time, we will not relax our controls in order to keep Hong Kong safe.